how did it help you as a person understand the union movement or your own strengths? And
Well, I think that gives me the courage, right, to speak up. Being a, sorry, someone that came in a third world country, Philippines, nurses are not trained to speak up. As nurses back home, even when I nurse in the Middle East, nurses are seen as assistant to the doctors. I don't even know that I have a right, like in the Middle East where I work as a nurse for quite a few years. If your doctor tells you something, that's what you're gonna do. You don't question. You have to do it. If they tell you to make coffee, you do go get coffee. But when I came into Canada, been on a union, well, I have a voice now. Now I could speak up. Now I could question what the doctor is writing, because now I've been trained to use my critical thinking or to, because I'm now a professional. Like back in the Middle East when I work, I've been looked at as a servant, like someone that being paid to serve them. So if a patient asks me to go get a water, I have to get a water even though it's in there. They call nurses a different name.
like what?
Sistera or a maid.
How did that make you feel?
Well, it made me feel like
With all the training you brought to the job? And
in the Middle East, well, I just felt like, well, I'm just here to do a job, and this is what you told me, then I'll do it. I can't question, I can't, say something, so.
So now you're in a completely different environment.
Now I'm in completely different. When I started my nursing career in Canada, when I finished my training in special areas in dialysis, ICU, and as year goes by, and now I have a voice, I told to myself, well, this is nursing.
You felt proud.
I felt proud to be a nurse. I felt proud to be an RN.
So that's the pride you took into all the work you did. And
Yeah. Now I could speak up, not only for myself, but also for my patient. Now I could tell the doctors, or I could advocate now for my patient.
how did you do that?
Well, by letting the doctor know, that this is what the patient needs, or if there are family meetings, and including them in that care. And that's how I advocate for them.
How COVID has impacted, any stories you have about your experience nursing with COVID?
Yeah. So I think I could relate my experience when I was up north. Because we're the community that I work, and I don't know if it's okay for me to say, but as you have seen, there are communities that do not embrace, do not believe that this pandemic exists. So it's a little bit hard when you're coming in as a healthcare worker, and now your organizations want you to implement these restrictions. And a community that is so against it, that's where the challenge comes from. And I don't know if you guys have heard that there was an incident that had happened up north where AHS workers' vehicles has been egged.
No. So this is healthcare workers trying to give healthcare, and they're being attacked.
Their vehicles were,
Well, that's attacking.
Yeah.
Yeah.
being
Is
egged.
that, how did people feel? How did this? What was your reaction?
Well, I think there was a misunderstanding at that time in the community because they thought AHS was there to police if they're wearing masks or they're complying to the Minister of Health order. Right, so I think there was a misunderstanding because at that time, yeah, there were AHS employees that were in the community, but this is because they're implementing the Connect Care system, and it's not about policing.
Still, I can't imagine how difficult it is to negotiate that with someone that you're working with in their home, and if they have a belief system that is at odds with some of the care that you're attempting to give, how difficult that must be.
But I think that's the challenge as a healthcare worker, right? Here I am, I want to advocate for my patient. Well, my patient has a right. The patient has a right to say, you know, well, I don't want to take that. Yeah, but then I am here, I said, but I need protection too. I also have the right not to be infected. Right, so how will I advocate for my patient who has a different belief than what I believe?
But a pandemic is a different thing.
That's right.
To you know, blood transfusion. I mean, their religious beliefs that don't acknowledge that, right? But that's a different kind of thing to a pandemic that's obviously having reactions in all communities, you know. So, did you feel unsafe?
I think in my line of work, I just have to make sure that I am well protected. Because if a patient or community don't want to wear mask, or you know, then I just want to make sure that I take precautions for myself, because really I can't, that's all I could do. I can't force them.